agents. And the aim of our company is to try and get people where they want to be.
Okay. And so today we are talking with Natalya Lukyanova. We are really pleased to welcome her to our careers talk. And I guess the best thing to do is to, first of all, just need to remind everyone that this session is recorded. So by attending the session, you agree for this to be recorded. And also the session will take form of an interview, but we also welcome you to ask questions. So if you have any questions at any point, put them in the chat box and we'll answer them at the end. So we'll start with welcoming Natalya and asking maybe to tell us a little bit about yourself.
Right, so yeah, as Anya Filon said, my name is Natalya Lukyanova. I'm currently a radiographer working for the NHS. I've graduated from the university in July 2019, so a year and a few months ago. I've studied at Queen Ethelburgas for my sixth form before entering University of Exeter for diagnostic radiography, but I originate from Russia, in the middle of nowhere, as we used to say, as people in this country say as well. So I come from a very unpopular and unfamous background, really. But yeah, for the last a year plus couple of months, I've been working for the NHS. I've been obviously facing the COVID pandemic recently, but I generally find my career very satisfying. Very pleased with that, and about any aspects really. So please ask away.
Okay. Well, that's great. Thank you so much. Can you just tell us a little bit about your sort of work? What do you do?
So a radiographer is one of the allied health professionals, as they call us. So we study for 3 years at the university. We are not doctors, because all my friends from Russia think I'm a doctor, whereas I'm not. I do not treat people. I can diagnose things from the images that we produce. So in my current job, in my current workplace, we take X-rays. Don't currently specialize in anything else apart from X-rays, plus portable X-rays. So the X-rays that we perform on the wards for patients who are too unwell to come down to the radiology department to have an X-ray there. Or we assist the surgeons via performing X-ray screening up in operating theater, especially common for orthopedic procedures whenever there is some sort of, for example, badly fractured leg that they put some metalwork in, and we assist with making sure that they put the metalwork in the right place, that they put the screws in the right place and all that sorts of stuff. So yeah, that's the three things I specialize on at the moment. Radiographers also perform CT, so computerized tomography, the scans that are performed on machines that look like a donut. Mm-hmm. Also, we do perform MRIs, not me personally, but if I progress further in my career, I can perform MRI. It's a longer donut, so it's slightly a longer scan. And we do perform ultrasound scans. I'm quite confident everyone have heard about ultrasound scans. So that's using a probe and a screen that we move around the patient's body. That's this area I'm particularly interested in, and that I look quite forward to move onto at some point. And very unfamous department called nuclear medicine. So that we are basically injecting the patients with a radioactive material, radioactive liquid, which spreads around their body. And the aim is, whenever they've got some sort of cancer tumor, it basically gets all this radioactive liquid, which acts as a contrast. It gets it all together, and it has a very high concentration of that liquid around the tumor. And then we use a special camera to scan and to locate where the tumor is.
Wow, that sounds really.
That's about it.
Yeah, that sounds really, really interesting. Also really varied as well. But I think when people kind of think of healthcare, radiography is maybe not necessarily something they think of straight away. Why did you decide to become a radiographer? What sort of moved you in that direction?
So I was generally thinking about healthcare as the way as a career choice. I knew that nurses do have quite a lot of patients contact, and they spend most of their time with patients, which I thought I might not be mentally capable of, because their job is so mentally and emotionally exhausting. I just thought it might not be quite for myself. Plus, I also had a huge interest in physics and biology. That all combined together led me to X-rays and all the other diagnostic procedures. So I'm kind of working with patients. At the same time, I'm working with some physics related things, and I'm working with biology. Obviously the images are produced using the physics aspects, physics methods, and biological aspects. So it's all combined together is very, very nice. So I thought it's a good way for me to move into, at least to start with my, as to basically start my healthcare career. I might move to other specialties later. As I said, I'm quite interested in ultrasound, but but at the moment I'm happy where I am, if that makes sense. I do know that this specialty is not very famous. Most the two more famous specialties in the NHS and healthcare are obviously doctors and nurses. That's part of the reason why my field is very understaffed. Same with physiotherapists, same with ophthalmologists, all very understaffed due to people who think about healthcare choices. They mainly think either doctor or nurse. They sort of ignore all the other fields which are there, opening the doors to all the other applicants and who are desperate for good students, who are desperate for people who actually want to study those courses and move their career forwards into more narrow fields.
And also really important as well, really important job that you do as well.
Yeah, that is true. We do say that we perform lots of scans. So I would say that in X-ray department alone, not to mention ultrasound, MRI, CT, or anyone else, in ultrasound, in X-ray department, sorry, alone. Let's say before COVID times, because COVID changed a lot, obviously, but before COVID times, we would normally see between 400 and 500 patients every single day in our hospital. Our hospital is not the largest one, but between midnight of one day and midnight of another day, within 24 hours, we would see about 400 to 450 patients. So that's quite a massive number. All those patients, they need diagnostic tests. They need tests to see whether they've got a fracture or whether the fracture that has been put in a cast is in the correct position. There are patients coming from the oncology to check whether they've got any masses anywhere, especially in lungs. There are pediatric patients who need X-rays and assisting for their treatment. There are lots of things. It's not, so all those 400 patients something are not including patients who are done in operating theaters or patients who are done in fluoroscopy department. So actually it's more than that, plus MRI, plus CT, plus ultrasound. It's all diagnostic procedures. I think in a day, in 24 hours, we make up to 800 patients, 800 diagnostic tests for different patients for different reasons, either fractures, either pathologies, cancer, or anything else. Sometimes it's crime related, sometimes it's anything, but yes, pretty much I would say 85–90% of patients who are admitted to the hospital for various reasons, at some point they will encounter a radiographer on their way, just because we are essential for diagnosing the problems that people are coming into the hospital with.
That's amazing. I would never have believed that. I don't suppose, thinking about it, I'm hugely surprised, but it's quite a stark number when you put it, in a numerical term, just how many people you can actually physically see in a day, particularly for somebody who didn't choose nursing because they didn't want to work with patients constantly. There's a steady stream of patients all the time. You talked briefly to begin with about, you know, going to school at Queen Ethelburgers and then going to university, but can we take you back to Queen Ethelburgers? What did you study for your A-levels? Did you specialise knowing you were going in this direction, or did you pick A-levels that were subjects you enjoyed and this came a little bit later?
Now, I must say, when I was entering Queen Ethelburgers, I already knew what course I would like to apply for. Radiography was already on the horizon, and I knew that I need to pick up the subjects accordingly to my future career. So I have picked up, to start with, mathematics, chemistry, biology, and physics. And I must say, I wasn't quite ready for the amount of academic work that I was facing in my year 12. So unfortunately, I didn't get very nice marks in my physics and chemistry exams. So when I was entering year 13, I was told that unfortunately I'll have to drop those two subjects because my marks were just simply not satisfying. I have been allowed to carry on with the biology exam, with the biology module, but unfortunately due to some, I would say, due to some clashes or issues with the timetable, I was forced to drop biology as well. So so in my year 13, I had to take on, so I carried on with the maths A-level and tech in sciences, which were, again, they were totally suitable for my course. My course would happily take anyone with BTECs or A-levels or international baccalaureate, I believe. So again, as I said, my course is very much desperate for people to go on to. And there are, I believe when I was applying for universities, there were only 26 universities in the entire UK, including Ireland, to apply to for radiography. And not many people apply, not many people graduate. And as a result, there is a shortage of radiographers. So as a result, some of the universities, they would be happy with not A star marks as they would normally take up for medicine, but they would be happy with, let's say, ABB or BBB. So it's quite achievable, even for people who come from other backgrounds like I did. I came from another country. I've never been familiar with the educational system in Britain. And that's part of the reason why I've struggled in my year 12 with the A-levels. So courses like radiography or ophthalmology or physiotherapy, they're pretty much achievable for people from other backgrounds who've never studied in this system, who just came for A-levels. It's more than academically achievable, I would say. But yeah, going back to my year 13, as I said, I took double BTech science. I still took a maths A-level, and I have achieved double distinction star in my BTech science and A in my maths. So I did get decent grades by the end of Queen Ethelburgers, but I had to study quite hard in my year 13.
I think I'll be fair and say I think a lot of what you just said is an understatement. Double D star and an A in maths is not just a decent set of grades, it's an outstanding set of grades. And to think that one of that sets of qualifications came in a year, I imagine you had to work incredibly hard to get through the volume of work in that time. So during year 13, when you knew what you wanted to study, how did you drill down which universities you wanted to apply for? Was there a process that you went through, or did you kind of already know where?
So again, with the university, so as soon as I decided which course I would like to study in, I basically just said, let me see what's the best university in that field and let me aim for that. And that was Exeter. So I've aimed for Exeter and I've achieved that. So it was simple as that, really. I must say, when I've started, when it was my year 13, and I started emailing some universities about the entry requirements, because on some websites they were not quite clear. It turned out that that year there was a massive change in the universities, and that year many universities did not accept international students into radiography. Turns out of 26 universities who had radiography, 24 did not accept international students that year. So the only two that were accepting international students the year that I was applying were Exeter and St. George's in London, which was taught on the base of Kingston University. So I only went for interviews in those two universities. I have been given conditional offers in both universities, but they gave me exactly the same conditions. So I knew that if the conditions are exactly the same, obviously I'm going to choose Exeter, and I've overachieved the offer that they gave me. So it was just all a happy coincidence, let's say. I mean, it was a fair bit of me working hard on my grades in year 13, but also it was just a happy coincidence with the fact that Exeter was one of two unis who was offering places to international students that year.
Luckily there were two, you know,
Yeah.
as a minimum. Tell us about the interview. What was it like? Because obviously, as you'll know, lots and lots of universities and different courses don't interview now, although I'm beginning to get a sense that universities are realising that this idea of interviewing online might be quite easy to deliver and run. It wouldn't surprise me if we don't go back to more interviewing, simply because they've realised this process is quite easily manageable. But really, interviewing is teaching, nursing, allied health, medicine, and and a few others. What's the interview process like?
So the interviews are normally divided into two groups, same as when I was interviewed for my job already. So interviews are either formal or informal. So the informal interview was in St. George's. They were putting you in situations. They were describing the situations, saying, okay, so you're in this situation, how would you act? For example, I still do remember I've encountered, so the person who was interviewing me, there were 5 situations. One of the persons said, okay, so I'm your elderly neighbor. I had a parrot that I've asked you to have a look after while I'm away for holidays for 2 weeks. And the day before I come back, you let the parrot out of cage and the parrot flies away into the window. And now I come back from my holiday. How do you react? So basically you just had to, yeah, so that's the informal interview. So you had to act accordingly to the situation. So basically what I said is I would be honest with what happened. I would really apologize. And I would say, because it's my fault, it's totally my fault. I'm really sorry. Because the gentleman was a very good actor. He was like, oh my God, I'm so lonely. I'm old. All my grandchildren and my children are not visiting me anymore. The parrot was my only friend. So basically what I had to say really, and what I did say, is that it's totally my fault. So let me buy you another parrot who will become your new friend. And the student who was sat behind that professor's back, he was literally just, as soon as I said, let me buy you another parrot, he just, he indicated that was the right answer, basically. Whereas the formal interview is more like, so why did you choose to study radiography? Why did you why did you choose to study biology? What interests you in biology? How do you see yourself behaving with certain patients? Where do you see yourself in 5 years? So all those classic interview questions that can be found in any interview preparation book, basically. But
any questions that surprised you? Anything that, besides the parrot question, obviously that must have been a little surprising, but any questions that really threw you as far as not being able to answer?
I wouldn't say so, because as I said, the informal interview, all the 5 questions were the situational questions where they would put you in different situations. So that was something that you can't prepare for. They make up the situations there at uni and they put you in there. It's just luckily that, luckily I knew how to behave. And I was just saying from the bottom of my heart, really, how I would behave in such situations. I was quite lucky that's what they wanted to hear, really. Whereas the classic interview, I've been prepared for the interview. I knew what sort of questions they ask. It's more like, I would say whenever you attend the interview, you're nervous anyway. So even if you've been prepared, you might just freak out and just forget all the answers that you've prepared for any sort of questions. So I would say sometimes it's about the pressure that the interviewers put on you. So even if they ask you a very simple question, sometimes it's the tone they ask, or sometimes it's the way they look at you, very judgmental, very sort of strict. Sometimes that's what puts you off, and that's what makes people nervous. That's why some of the people fail their interviews, even if they're 100% prepared academically, mentally, emotionally.
Did you have any work experience before you made your application?
Yes. So the year before I've applied for universities, I did have 2 weeks of work experience in the radiology department in Russian hospital. And then I did have a couple of days of work experience in York Hospital in the radiology department. I must say, unfortunately, it wasn't very busy during my visit there, but they still showed me around. They put me into different parts of the department. They've put me into emergency rooms. They've put me into general rooms on the reception. So they allowed me to see the pathway of the patient as they follow through the department, really. They allowed me to see the equipment, to see the control panels behind that screen that you hide when you're taking an X-ray. So it was useful. It was definitely useful, and it was useful to see what kind of people are working in such field in the UK. Whereas in Russian hospital, I did see the process of working with the patient, but I also attended quite a lot of sessions of the radiologist describing the images. Just looking at the images and saying, right, chest is clear, chest is clear, chest is clear. So it was quite a different experience, I must say. So I think if anyone is ever coming for this career from another country, they should probably attend the work, they should probably arrange work experience both in their country and in this country, just to see the differences, just to see different approaches. Because, for example, this field in the UK is very different from that field in Russia. So having a couple of days of work experience here really helped me to understand that. And again, thanks to Queen Ethelburg School, that they were very understanding with the fact that I need this work experience, and there was no problem whatsoever with allowing me to skip 2 days of school just to have 2 days off at the hospital.
Oh, okay.
Okay, so we talk about your study at university. What was challenging? What did you enjoy the most? What was it like?
I must say, for me, the most challenging thing was writing the essays. I'm generally not an essay person. Quite, like, I must say, like, as a personality, I'm quite blunt about what I'm saying. So whenever someone asks me a question, I'm usually like, I see no point about talking about that for a long time. I would rather just say a couple of simple words that describe the problem. That's it. So when someone asks me to write 3,500 words about a particular aspect, I'm just like, oh my God. Whereas the actual exams or the actual lectures, the practical seminars, they were amazing. The most enjoyable part was the placement. So I've been at uni for 3 years, and each year for about 3.5 months, 3.5 to 4 months, I was at one of the local hospitals doing the actual job as a radiographer, obviously as a student, obviously under supervision of qualified radiographers, but I was actually at the hospital every day doing different things. And as you move forwards during your first year, for example, because you've only just started, you only do 9 till 5 Monday to Friday. During second year, you start working some evening shifts like 5 till 10 in this local hospital, for example. So you start seeing the hospital from slightly different perspective, because during the day, it's all the, let's say, normal and planned stuff, all the clinics, all the patients who are not urgent, who just need to visit a doctor at some point of the day. That's what's happening during the day. That's what kind of patients you normally see during the day. During the evening, the only thing that is still going on is the emergency department. So you get to see different things. And when you're a third year student, you do a couple of night shifts as well. So you do get to see the department run by 1 or 2 radiographers and the student only dealing with emergency department patients. So that was my favorite part of the course, is actually applying all your knowledge that you got throughout the lectures, through your seminars in practice, and seeing how good you are at the job that you are required to do.
It's amazing. Yeah, that sounds really interesting. And what was it like finding the job? Was it easy? Because I know there's a shortage of radiographers, obviously.
As I said, we're so short for the radiographers. So when I was in my second year, just the second year, hospital where I'm currently working, where I was on placement in my second year, some of the radiographers have already been asking, so where would you like to work after you graduate? Would you like to apply here? And just winking, just like, would you like to come and work here maybe? So, and I said straight away that I definitely would like to come and work here in future. Just let me know whenever the job is out, I'll apply for it straight away. So I did keep contact with a couple of people, including the management. So during my placement, I went to talk with the management of the department, saying I am interested in working here. Please let me know. That's my email. Please let me know whenever the job is out, and I'll apply for it. And that's exactly what happened. As soon as they've opened the vacancies, they emailed me saying, please do apply. We are waiting for you. And they've invited me for the interview after my application. I mean, the applications, whenever you send them, they are anonymous, but there are things that you can indicate a particular student from, because I would imagine not many students indicate that they know Russian. So they sort of knew it's me, even from the anonymous CV. So, I mean, I know that the majority, if not 100% of my course, at least like the majority of people have had the job by the time they've graduated.
Wow.
Many of them have had the job like a year before they've graduated. I've sort of been guaranteed the job about 8 or 9 months before the graduation. So the majority of people have had a job, and those who didn't, they just wanted to progress with their studies, so they've applied to other unis for masters or for another courses. So as I said, there is a shortage. So you will, if you apply to study radiography, you will be guaranteed a job. The only problem is that sometimes if you didn't perform quite well or on your placement, and the hospital staff do remember about you, you might not get the job in exactly the hospital you want, but you will be able to get a job somewhere. So in my radiography course, I think there is like 99% employment rate within 6 months after graduation, but I have a feeling it would be 99% even before graduation, really.
Yeah.
As far as I'm concerned about my cohort, we had about 66 people graduating, only 66 people. all of us had jobs or studies lined up before we went for the graduation.
And I guess it's job security and
job security is one of the best things about this profession. It's one of the, because obviously you would like to do something that you are very passionate about, but also when you are passionate about something and you know you would be guaranteed a job, it makes you even more, it makes that field even more attractive, doesn't it?
Absolutely.
It certainly helps at times like now when jobs outside of healthcare can be a little bit unpredictable. I guess it's nice that you're going into an area to study where the job prospects are pretty reasonable at the end of it.
Oh, definitely.
You touched earlier on the different kind of aspects of radiography and about the different arms of it, the CT scanning and then MRI scanning. How do you specialise? So you qualified, you've got your degree, you go into the hospital. What happens next if you want to, do you want to do that kind of thing with the donuts?
So for example, I am a qualified radiographer now, as I am. If I would like to go to CT or MRI, in my hospital, for example, there is no way to go into MRI unless you go to CT first. So you go to CT and only after a couple of years you are allowed to go to MRI. But the way I do that is I go to my manager and I say, I am interested in potentially developing further in the CT department. Would you mind if I spend a couple of days around there per month just watching what they're doing, maybe helping them? So they organize you a couple of days in the CT department per month. You're watching what people are there doing. You're helping them. If they're keen on some other people arriving, which normally they are, they teach you about the modality. They say, that's what we do. That's what you're looking at on the scan. That's currently what I'm trying to do with the ultrasound, because I'm quite keen on doing that. So for the past 8 months or something, normally at least once a month, I would like to spend a day around an ultrasound. So I'll be watching the sonographers doing scans and explaining to me what sort of anatomy they see on the screen, how you get to the particular organ, what pathology they're seeing, and everything like that. And whenever the job opportunity arises, for example, normally, at least in our hospital, I'm pretty sure in the NHS generally, the job opportunities arise sort of October time, October, November time. So I do know there are 7 CT jobs arising soon in my hospital. So if you're interested, you apply for that. You need to do a proper application through NHS website, and then you go for the interview. And obviously, even if you haven't had any days arranged in CT department, even if you haven't really expressed any interest, potentially you still do have a chance of getting to the department.
Some technical issue.
I wasn't sure whether it was me or Natalya.
Maybe it's Natalya. Hopefully she'll be back, because it's really interesting what she was telling.
Yeah. I'm quite surprised that you don't have to have formal training to be able to take that next step. I would have thought that it would be train, job, train, further, job. Whereas it appears that you just express an interest and they'll take you on and train you from there. I suppose is good.
She dropped on the call.
Yeah, hopefully she'll come back in.
Hopefully, yeah. Well, we only have Alex on the call.
Alex, do you want to put your mic on?
Can you hear me?
Ask to arrange days to spend there. So by that, you show your interest in that modality. And whenever the opportunity arises, you are sent an email out by your management of the whole department saying, there are currently 7 CT jobs going on, please do apply. The deadline is 10th of December, let's say. So you apply for the job, you get interviewed. If you're successful, you get a job, you get promotion. that's about it. Pretty much the same works if you are interested in a job, but with another hospital. You usually would just contact them saying, I do work in another hospital at the moment, but I am interested in working for you, maybe for like an MRI job. Would you mind contacting me whenever you've got a job for me? And then you go through a normal process of applying for a job through NHS website, and then you get shortlisted for the interview. There are unfortunately people who can't interview whatsoever. They just get very nervous or they never prepare, and they do try for years to move to another modality and they never succeed. So I do get that part of it is just whether you are naturally a calm person or not, whether you can cope with your nervous system or not, but sometimes it's all about the preparation as well.
But there is a certain hierarchy between the jobs, between the different kind of modules. So you have to work for a certain amount of time before you can move up. Is that right?
Normally that's the case. Some jobs specifically say at least 2 years of experience.
Right.
Whereas sometimes I would say it just depends on how desperate the department is. Because for example, normally those 7 CT jobs would be for those who are 2 or more years of qualified. But if they're desperate enough, they might consider the candidates with less experience. Sometimes it just depends as well whether they have been trained in the UK or not. Because obviously if you're trained in another country, they don't know how close the systems are to each other. They don't know whether the responsibilities are the same. They don't know whether the standards are exactly up to the same standards in this country. Because I would love to say this country has very high standards in radiography. It's very clear, but it's very clear on your responsibilities, what you are allowed to do, what you're not allowed to do. We study quite a lot at the university, even though we don't use all this knowledge necessarily when we graduate, but we do know quite a range of things. Whereas in other countries, you're literally told what to do and you do that without questioning that, without having a background knowledge to argue about that, without having the knowledge to say, I don't think that's quite the right thing to do. I don't think it's quite safe. Because obviously when we are working with radiation or a strong magnetic force with, for example, MRI, we have to consider the patient's safety first.
Okay, I've got a question for you then. So a radiographer, what kind of skills does a radiographer need?
So responsibility, just like in any other healthcare related profession, I would say. Good communication is essential, as again, it's not specific just for the radiographer, it's essential in any other healthcare job, but it is quite important. Even though we rely on machinery all the time, the communication needs to be there. But also you need to be very much aware of the safety, like both for staff and both for patients, because obviously if we work with machinery, which either produces X-rays, which is a radiation, ionizing radiation, or MRI, which is a very strong magnetic force. Not to scare anyone, but MRI rooms, magnetic resonance imaging, are the most dangerous rooms in the hospital because of how strong the magnet is. I must say, like, if you've got any metal clips in your head and you're standing next to the MRI scanner, you can see these metal clips pulling your hair, or like you can feel the wires in your bra moving towards the scanner. So if you bring any metal object into the room, it flies across the room into the MRI scanner, nice and easy. It has been done. It is dangerous. So you need to be very self-aware of what you're doing in terms of patient safety. You need to be able to have very good communication skills, and you need to be able to build trust with the patient very quickly, because obviously, as I said earlier, we don't spend as much time with patients as nurses normally do. So we have very limited amount of time to build that trust with the patient, to get them comfortable to be with us. to make them reassured about we are here for your best interest. We are not going to do anything that will harm you. We are here to help you. Obviously, we are very limited about the time. Because we usually have either appointments or certain time frames that we're supposed to fit into. They are flexible most of the time because you never know what kind of patient you come across. Sometimes you think it's just going to be nice and easy, whereas it turns out the patient who attends an MRI scanner has claustrophobia, but really needs it. So it's not it's not going to be easy to get them into that scanner. Or sometimes you come across of people saying, "I don't think I'm going to be able to do that just because I can't." Sometimes you're not told that there are certain obstacles on the way that you will need more time to cope with that issue or with that aspect. Let's say, I don't want to call it an issue because obviously everyone is different and no one is guilty for having a certain phobia. So I wouldn't want to call it an issue really. And obviously skills of time management, because as I said, we usually run by appointments time. You usually need to be nice and quick and efficient in your job. So even if you're not quick in the beginning of your career, usually you will get trained and you will be able to perform your job in a nice, smooth, easy and quick way. And for the radiographer specifically, I would say you need to have some certain skills, some certain knowledge, both academically in terms of physics and biology, and both in terms of psychology. So you are working both with machinery and the people. So you need to be able to move smoothly all along that. Because we work with a range of other professionals. We work with surgeons, we work with emergency consultant doctors, we work with nurses, we work with physiotherapists, we work with healthcare assistants. We need to be able to, we are usually quite well aware of different healthcare roles existing in the system. And you need to be able to know sort of to an extent what are the responsibilities of other healthcare professionals are. So you need to know what they are aware of, what they're not, just to be able to move and to keep the process nice and smooth for everyone. Again, communication is the skill here, because if you don't know something, if you aren't sure, the best thing is to do is to ask. In the NHS, there is a culture of learning from mistakes rather than punishing for it, which is very pleasant, because this way people are not covering their mistakes. They come to you and they say, that's what I've done. I do realize it's wrong now. That's what I've done. I've reported my own mistake. What do I need to do to avoid that mistake in future?
Describe us here.
If I've moved into another way.
I think that's really interesting. It's very useful. And I think I really like that you kind of think broader about it, because I think people just sort of think, radiographer needs to be good with machines and etc. But actually, there's so many other things that you need to be aware of. And, it's really interesting to kind of find out. Describe us your typical day or night.
Yeah. So I do work a range of shifts. So I probably should start with the fact that obviously, since the radiographers are essential for running the operating theater lists, since they're essential for running emergency departments we are working day and night and weekends and Christmas and bank holidays. We are working 24 hours a day. Radiology department doesn't stop working at all, at least when it comes to X-ray and CT department. Other modalities, they do have that thing where they say, well, that's urgent enough, that's not urgent enough. So that can wait till the morning. In X-ray, we do have urgent patients throughout the 24 hours period, 7 days a week, 365 days a week, 65 days a year, sorry. So I do work a range of shifts. So in my particular hospital, I can be either doing a week of 9 till 5s or 8 till 8, 8 a.m. till 8 p.m., or I can work 10 a.m. till 10 p.m., obviously when you're working longer shifts, you do less days a week, or can be doing night shifts, which are 10 p.m. till 8 a.m. Monday to Friday and 8 till 8 on Saturday and Sunday. We do have on-calls as well. So on-calls are meant to be, so you're staying at home, but with your phone on loud, in case of people who are doing the shift while you're sleeping need you. In case if there is an emergency theater going on or something unusual happening, they're short of staff, they need an extra person, they can call you from home and you arrive. So the typical day, for example, I arrive on my shift at 9 o'clock in the morning. I do go to, I do attend a meeting in the morning where we just see where we are allocated for the day. So for example, I can be allocated to either a general X-ray for the day where we normally see GP patients or outpatients who come from different clinics, plastics, diabetics, oncology, anything like that, or can be allocated to emergency department rooms, which obviously deal with emergency department patients, or can be allocated to do portable X-rays. So portable is we take these little, relatively little X-ray machines to different wards for patients who are too unwell to come down to the department. I must say we only do chest X-rays on the wards because of obvious radiation risks to patients surrounding the patient that we're actually X-raying. It's a radiation risk for the patients, for the ward staff, for everyone else. Usually the images are worse than the ones that you get in the department, but that highly depends on the equipment. So we do only do these portable X-rays in case of an emergency. But these emergencies do happen about 10 times a day or more. So, or I can be allocated to do some imaging in the operating theater. Normally, the theaters were needed for urology. So it's something to do with the kidneys, bladder, anything to do with putting the stents or anything like that. Or we can be allocated to orthopedic theaters. That's most of the time who needs us. So whenever they insert a metal rod in the bone, or they screw and put screws into a bone and the metal plate just to make the fracture stable, that's when they need us, just to make sure that all the screws go into the right direction. Sometimes they need, sometimes the surgeons need us for spinal operations. So just to make sure they are operating on the right level of the spine between, for example, I don't know, the third and the fourth vertebra around your lower back. And they just need us to make sure that's the level they're operating. So it's just a range of different things, really. So, or you can be in other X-ray rooms, for example, orthopedic, where you would mainly X-ray knees or hips that need replacement. And that would be your whole day. You normally X-ray just the joints that are quite arthritic and that require replacement. So you basically just check wherever you are needed for the day. You are aware that even if you have been allocated to theaters for tomorrow, it might change depending on whether we need more staff. So that's just about it. And if you're doing a late shift, if you are staying till 10 o'clock, after 5 o'clock, from whichever area you were in, you come back to the emergency rooms, and that's where you spend your entire evening. So, and then normally throughout the day, you just go with the flow of the department. If the senior radiographer is, who is the duty that day, if they tell you to do something particular, you just follow their direction, because they're controlling how the department works, they're controlling the flow, they're controlling what's happening. So that's about it, really.
Really busy?
It normally is quite busy. I must say it just depends. During COVID, obviously we don't have GP patients because they've been canceled. Outpatients clinics are not really running, so we do have less patients. But at the same time, for example, we can be called for portable X-ray whenever, because it's an emergency, isn't it? So the emergency department, people from emergency department, patients from there can arrive at any point because it's an emergency department. So it's something that cannot be planned. It's something that we don't have the appointments for. So one minute you are sat there doing nothing, and then another minute, all of you are gone. All 6 people are gone to different sides of the hospital doing something extra, something on the side. Yeah, so sometimes it's uncontrollable.
Yeah, definitely.
Well, if somebody found themselves in the same position as you and they know that they want to do radiography at university, is there any advice you'd give them on things to do, or perhaps resources to read or resources to kind of get involved with that would help them along the way?
So again, because this profession is not very well peered, let's say, if you want to read about anything about this profession, about what we do, anything, the best website to go on to would be the Society of Radiographers. They described quite well about what we do, what are the last news and updates about this field and about this profession, what are the best career choices, what you can do, what sort of range of things you can do. I would definitely advise trying to arrange a work experience, even for one day. Just arrange a work experience in the radiology department at the local hospital, just to see what it's like, just because some people, even on my course, they have been entering this course without realizing what it actually involves. And whenever they were going on the first placement, which was at the end of the first year, so it was summer, the year after they started, they've entered that and they said, that's not what I wanted. So if they decided to quit the course at that time, they've lost a year at least. So you need to be aware that this profession does involve quite a lot of patient contact, that we still do care about the patients, that we still do work with them. We do have a range of responsibilities. It's not, unfortunately, just pressing the button. There is a famous joke about the radiographers that we are just button pushers. Unfortunately or fortunately, it's more than that. You need to study all the physics in relation to that actual button pushing, because again, you wouldn't think about that unless you are told, but obviously different radiation doses are required to have a look at your finger and have a look at your tummy, for example. It's totally different radiation doses, and you need to set particular parameters to be able to achieve that optimal radiation dose and not to overexpose your patient. There is, yeah, because that really affects the quality of the image as well, and that really affects whether you are a competent radiographer or not.
It's not just taking a photograph, is it? I think a lot of people, that's exactly what it is.
That's it. Sometimes I wish it was that simple. Unfortunately, it's not. So as I said, the best source to read about that profession from the professional point of view, from the most updated version of how things are going, are the Society of Radiographers website, which is easily found if you just Google through it, and just arranging 1 or 2 days of work experience at the local hospital in X-ray department. That's what that should help you, and just try to see what are actually radiographers doing. Not just talk to people in the department, though that might be helpful, but actually seeing how they interact with the patient and what sort of things they're doing.
Okay, ready for the challenging question? So 2 dates in the future, 5 years from now and 10 years from now, what do you see yourself doing professionally?
So in 5 years from now on, I would like to be a consultant sonographer. So what that basically means is at some point I would like to move to ultrasound. In there, I would like to take extra qualifications to be able to scan pretty much any body part that I would like. Do a research about a particular field I'm interested in. By developing that unique expertise, you become a consultant sonographer by taking up research and therefore affecting your own practice by saying, right, I've done a clinical research and I've done a scientific data analysis. I can prove that doing this scan in this particular way that I'm doing is actually more beneficial for the practice that the current standards suggesting. So
Right.
by doing that, you become a consultant sonographer. That's what I would like to do. In 10 years time, God knows, but I honestly haven't thought that far. What I know I would like to do is just being promoted. Obviously, it's not fair not to mention that I would like to earn more than I am earning now, just because I think having your own accommodation, having financially comfortable level of living is what helps massively with your career, because when you are not concerned about making the ends meet, you can focus on your work and you can focus on your career. And I would like to still take up extra courses, extra master classes, and just develop in my field further and further until, I mean, it's not that difficult in my field, to be fair, to become an expert in a particular way. It's just at some point I would like to become an expert who is so valuable for the hospital that they wouldn't want to let me go. So
Fair enough.
So I did meet experts while I was a student or while I was attending just experience day in other departments. I did meet experts who were so good that different hospitals were fighting for them and were saying, no, but if you come and work for us, we'll offer you this salary and we'll also offer you a bonus and we'll also pay for your accommodation for the first 3 months you work for us. Whereas another hospital is saying, no, but we'll pay you this salary and we'll also pay you twice as much in bonus and we'll pay for 6 months of your accommodation when you come for us, and you also can choose your own shifts. And then that person is like, I don't know, this one is better and more financially beneficial, but this one is closer to my house. I don't know.
A nice position to be in.
I would like to become that kind of expert.
Yeah.
And to be honest, I think you will, because I really like that you've got this sort of all planned out. You seem to be very driven and you've got the goal ahead of you. And I think that's the way to do it. And when you said it's easy in your field, it's not easy for most of us. So I think it's probably easy for you because you're obviously working there and you do really well.
I mean, no, thank you very much. It's just, I always say, whenever I say it's easy enough, it means if I've achieved what I've achieved so far, it means nothing is really impossible. So it's just taking a step after a step. It's not trying to rush and get all done at once. It's just having that clear plan in your mind and following a step after a step just to gradually achieve what you need. I know I'm not going to achieve that within a year time, but I'm quite confident I can achieve it within the next 10 years, for example.
Yeah, sure. Well, we wish you good luck.
Thank you very much.
Yes, absolutely. So shall we just ask for audience questions?
Yeah.
Any questions?
Just one question, going back to when you said you were doing your placements at university. Would you say that it's best to go to a university close to where you'd like employment? So say if you're doing a placement and you said that you got offered a job at where your placement was, or do you think you could literally apply for a job anywhere in the UK for a healthcare profession?
I've applied for a job anywhere. I honestly did apply and I got a range of interviews. I got interviews at Cambridge, in Oxford Hospital. I got one in York Hospital. It's just that I didn't attend it. I had a range of course mates who were, for example, from Liverpool or from Manchester. So they never managed to go to the places where they wanted jobs for placement.
Yeah.
But they still applied for jobs over there. They said, right, I live in this city. I'm originally from here. I've studied at Exeter. That's what I got. Can you please give me a job? And they were given a job. So So I would say it's quite nice. It's quite nice to get a placement in the hospital where you are thinking of working, just to see what it's like, just to see what kind of team they've got. Because the team quite often makes a huge difference about whether you want to work at that place or not. But it's not just because you go somewhere for the placement. First of all, it doesn't guarantee you're gonna get a job there. But also, just because you haven't been there for placement doesn't mean you're not gonna get a job there. So it's either way. It's working either way. As I said, the shortage of radiographers is all across the UK.
Yeah.
Even if you went to Exeter University for radiography degree, doesn't mean you can't get a job as a radiographer in Liverpool, because they're pretty desperate in there anyway.
Yeah. Thank you.
Right, so any more questions? I guess we're gonna leave it at this. Nicola, do you have any more questions?
Not that I can think of, no. No, I've been thoroughly, not just entertained, but that entertained makes it sound lightweight. Entertained as in I've learned things. I kind of have a bit of a new perspective on some things as well.
Yeah, it's
Very
been,
nice to hear.
it's been really
That's what sort of I was trying to achieve.
Yeah, it's been really interesting to kind of learn about that field. And obviously, as kind of patients, I think we have one perspective of this, but when we you know, learn about the insights, it's very, very interesting. Yeah, we've got a question here. How can you be successful in the medical area? Is there anything you can add to this? That's a question from someone who just joined us. I guess we've discussed quite a lot already. Would you like to add anything to this?
So how can I be successful in medical area?
Yeah, I think how can one be successful in the medical area?
Okay. I think it's just one of the things I mentioned to anyone who is thinking about medical related career is just realizing it's not always going to be great, realizing there are lots of obstacles, realizing there are, for example, certain protocols that you need to follow just to keep yourself safe. And sometimes you know it's not quite right. Sometimes you know the protocol is not fulfilling the patient needs, but that's as much as you can do. Sometimes it's just realizing you can't help everyone. Sometimes it's realizing some people don't want to be helped to. You do get patients who are admitted with quite bad health issues, but they are doing everything to prevent you from helping them. And even though you're trying to do everything in the interest of the patient, you either have to agree with them not consenting to the procedure if they're capable of consenting or non-consenting, or you need to sometimes physically fight with them to provide them with the best patient care. Usually that happens with people who have mental health issues, who are not able to speak for themselves, and we act in the best interests of their health. I mean, it's a very fulfilling field when you are succeeding with something, when you know that your particular task now made a huge difference, when you know you have been useful today. This feeling is just undescribable. It's amazing. You know you're existing for a reason. You know you've got a life purpose. But at the same time, I think you need to be quite realistic about the fact that medical care is not ideal. There are a range of obstacles. Sometimes it's people themselves, sometimes it's just the bureaucracy or certain protocols, sometimes underfunding. Sometimes people ask you, well, why did I have to wait for 3 weeks to hear my result? And you're like, I know, but there are simply not enough doctors to produce the report for your x-ray quicker. And when they ask you, well, what can I do about that? There is no other thing as to say sarcastically, train yourself as a doctor. It's very bad, but Sometimes you've got no answers to these questions. Sometimes people are upset and they address you the issues that you can't have the answers to. It's just being mentally ready for anything that comes up, for any good things or any bad things. It's just being mentally ready, and not to mention that you can come across some people dying, for example. It's also very bad. We, as a radiographers, again, we do attend trauma calls, for example, when the patient has been in a very bad car crash. They have been airlifted via the helicopter from the scene where it happened to the nearest hospital. And as a radiographer, you do attend that trauma call together with a few doctors, a few nurses, a few specialists responsible for theaters running. So you are just there waiting to be told what is needed. Normally you take chest x-ray and a pelvis x-ray for people who have suffered some sort of trauma. And you are aware that sometimes the person you might see is going to die in a couple of seconds. So you need to be ready for all these things as well. Because as I said, a couple of my course mates, they haven't been ready for that when they've entered the placement. And when they've seen such things, they said, I didn't realize I have to deal with that. That's not for me. So as I said, again, arranging a work experience, it can get you ready to an extent at least. But also if you've got any people, any friends of the friends, any of your parents' friends or anyone working in that field, it might worth be talking to them and asking them, right, so what it's truly like tell me the worst things about that profession, tell me what the worst things you've seen, just to be ready for that. Because I think it's very bad when you have chosen a career, you thought you're gonna like it, you thought you were ready for that, and then you realize you wasted a year or 2 years of your life on a profession that you don't really like and you were not ready for. So I think it's just trying to do as much research in that field as possible, really.
Thank you so much, Natalya. Thank you. It's been really interesting and informative, and I'm sure very, very useful as well. Okay.
Thank you. Can't say thank you enough. It's been really, really good.
Thank you very much.
So for those who are listening to us, if you have any questions, you can just send us a message on our Instagram or just email us, and we'll obviously get back to you with an answer. We can ask Natalya to get back to you as well. Okay.
Yeah,
Thank you
so much. Yeah,
we'll
that's fine.
finish
Thank you so much for the invite, though. It's been a pleasure.
Okay. Thank you.
Thank you.
Have a nice
Thanks.
evening, everyone.